According to Heart.org, about 10% of the more than 6 million Americans living with heart failure have advanced heart failure. Today, during American Heart Month, we're diving into the progression of this syndrome with Dr. Coney, an advanced heart failure cardiologist at MUSC. Dr. Coney, thank you so much, and you're joining us for Columbia. We're very happy to have you here.
Well, thank you so much for inviting me. It's wonderful to see you all.
So, advanced heart failure, is it exactly what it sounds like?
It is exactly what it sounds like. It's the sequence of heart failure as it progresses. When it progresses from regular heart failure, which is a heart function where your heart is squeezing at about 40% or less, that's where you diagnose heart failure. Advanced heart failure is when you have the decreased heart function in addition to multiple other symptoms that are resistant to the current treatment guidelines.
Okay. What are some of those symptoms?
Well, you can consider swelling in the legs, significant swelling. You can have cough with increased sputum production that it's white and clear. It's from fluid that's inside of your lungs. There's also having shortness of breath that wakes you up from night, or shortness of breath that causes you to sleep in a recliner or in a chair because you can't breathe. Those are very common findings in heart failure and advanced heart failure. Additionally, you may find that these patients also have recurrent hospitalizations for heart failure that are not able to be stopped.
Okay, is it diagnosed just based off of those symptoms, or are there other forms of diagnosis?
Advanced heart failure is diagnosed off of symptoms and testing. So the common tests would include ultrasounds of your heart, which we call an echocardiogram, or also having heart catheterizations that demonstrate poor flow to your organs because of heart failure. And there are also testing such as images for the MRIs of the heart or nuclear studies of the heart. Altogether, those tests come together and we are able to compile a patient profile to determine if they have advanced versus routine heart failure.
Okay, and now what does treatment look like for advanced heart failure?
What is the treatment? Well, typically there's a 4 to 5 drug treatment for all heart failure therapies. And these heart failure therapies have been researched from multiple people, and over the last decade have been more advanced than before because of the intercollegiate network internationally. After the 5 drugs are started, we reassess patients for improvement. If there is no improvement, there's also treatments that can include devices that can be implanted. The ultimate treatment for a patient with advanced heart failure who is resistant to therapy is a heart transplant or a robotic heart implant called an LVAD.
Okay, and you recently, about a year ago, brought a new type of not as invasive treatment to MUSC in Columbia. Can you expand on what that is?
Yes, most recently we were able to introduce the baroreceptor augmentation device. And what that device does is it affects how the body responds to heart failure. Inside of our neck is a nerve bundle that tells our body when to beat quickly or when to increase our blood pressure. It's associated with the flight or fight response, which would be our stress response. We can falsify a stimulation to the neck and to make it seem as if the body is not under extreme stress. Using this device, we can release electric pulses to tell the body to do the opposite of what fight or flight would do, which is to calm, relax, decrease the heart rate, and even decrease the blood pressure. We've seen great opportunities that are continuing to show up. Patients have had great testimonials, and I am looking for patients who can benefit from this. This includes advanced heart failure patients who have been resistant to medicine, but are also not yet candidates for a heart transplant. This may be able to slow the process of them needing to have a heart transplant in the future.
Wonderful, Dr. Coney. Well, thank you so much again for joining us today.
Thank you so much. Bye-bye.
We're back after this.